Now, breast cancer is one of the most common cancers amongst women in South Africa, and almost 1 in every 25 women are likely to be diagnosed in their lifetime. October is Breast Cancer Awareness Month, an annual campaign to increase awareness of the disease. Now, to discuss this, we're joined via Skype by Dr. Pieter Henning, a radiologist and director of Keystone Medical. Thank you so much for making the time to talk to us today.
Thank you for having me, Desiree.
Now, who is at risk of developing breast cancer?
Well, we used to say that the peak age of breast cancer among women is about 50 to 60 years. But there's been a world tendency to shift to a younger age, and we can now safely say that all women are at risk of breast cancer. Breast cancer is by far the biggest cancer in South Africa, and the incidence of breast cancer among women is fourfold higher than all the other cancers, which is lung, thyroid, and colorectal cancer combined. We also know that in South Africa, the incidence of breast cancer is about 30% higher than the world average. And one of the reasons why this is seen in our country is because there's a lack of a national screening program. Now, with October month here, this is Breast Cancer Awareness Month, and I consider this to be the most important October in many years, especially following the COVID-19 pandemic. We have seen among medical aid patients in South Africa a 51% reduction in screening for breast cancer taking place during this period. So it is absolutely pivotal that we focus on breast cancer during the month of October.
So that 51% reduction, is it as a result of giving more emphasis on COVID-19, or is it as a result of the lockdown and people were not moving about?
It's definitely a combination of both. First of all, we see that patients are afraid to go into hospitals. And unfortunately, in South Africa, we base our breast screening facilities mainly inside in-hospital facilities. So there's a common fear among patients. Also with the lockdown, people that felt abnormalities in their breasts did not want to go to the doctors and the healthcare facilities out of fear of contracting the virus. And among our patients, we can see there's a very serious and very high increase in late diagnosis of breast cancer. Now, this is very important because breast cancer is actually curable if it is diagnosed at a young age. And this is at a young stage. And this is exactly why we emphasize the importance of mammographic and ultrasound screening for breast cancer.
Yeah. So what symptoms can people look out for?
Well, the most important symptom is if you feel a palpable lump in your breast. Now, usually breast cancer is not a painful lump, but with that, any changes in the form of your breast, dimpling, skin changes, or your nipple retracting can be early signs of something developing inside the breast. The advantage of the screening facilities and the reason why we screen is because we can detect those changes long before it's palpable. Unfortunately, it takes about 5 years for a lump to develop about 2 centimeters. So it just tells you how important it is to do early screening.
Yeah. Dr. Henning, what treatment options are typically available for breast cancer? As you said earlier, that it's treatable if detected early.
Well, just to put this into perspective, this is the cancer that has become the most important in research and treatment options in the world. And we all know that there is a worldwide increase in the amount of treatment abilities that we can offer patients. In the past, it used to be surgery and radiation. Now, there's still and there will always be a place for those treatment modalities in breast cancer. But after we've discovered that there's not simply one breast cancer, but actually many different types of breast cancer, which can be sensitive to hormonal treatment, biological treatment, and certain specific cancer treatments such as herceptin, which you may have heard of, that has totally changed the survival rate and the cure rate of breast cancer in the world.
One of the conversations around this is the concern that people have about the possibilities of side effects of each of the various treatment options. Can you take us through these?
Yeah, unfortunately, so many patients come to our facility and say, they do not want chemotherapy out of fear of losing their hair, or, do not want the scarring of mastectomy where they remove the breast. Well, we know now with science that removing the whole breast is not necessarily the number one treatment option. And the type of drugs which have been developed now actually has a lot less side effects than your traditional chemotherapy and radiotherapy drugs. So sometimes when it's a hormonal sensitive cancer, you will literally drink a single tablet for the next 5 years, which will suppress the cancer and which has minimal side effects. So with technology, we've basically developed better treatment options with a lot less side effects. And then the side effects themselves can also be managed by new drug modalities. So definitely the risk of letting a cancer grow compared to the side effects from the drugs are far less.
Yeah. So as we mark this month of October, and you said it's one of the most important ones in a while, what can we say to our viewers about what they can and what they should do?
Well, first of all females above 40 should be screened for breast cancer with mammography. And at our facilities, we also include ultrasound because it increases the sensitivity of detecting cancer. Now, because of the COVID pandemic and the lack of accessibility to hospital, Keystone Medical decided to increase our out-of-hospital offering of mammograms across the country with the implementation of a mobile screening unit, which we are sending across South Africa, where women can experience a world-class digital mammographic and ultrasound facility. We also integrated this with the first live reporting system in Africa, where the ultrasound images with the digital reporting is done anywhere in the country immediately by a radiologist that can give feedback and treatment options to patients directly. So there are options available outside hospitals. Women above the age of 40 should all go for a mammogram, but as we say in our profession, cancer do not read textbooks. So if you feel any lump, any change in your breast, any discharge that's perhaps abnormal or developed early, rather go to your healthcare professional to have it checked out and find and make sure that it is not a cancer. The basic rule as well is that with females that have a family history of breast cancer, like a first onset relative such as your mother, grandmother, or a sister, you will go for your first mammographic screening 10 years after the age at which their cancer was detected.
Yeah. You know how the conversation about cancer awareness is always go do your mammograms, go do your screening. But there's a big chunk of our population that is not, has not got awareness or the ability to get information about the how part. And the biggest concern here is always about affordability. What kind of information is required here?
Well, first of all, when it comes to information, I think with social media and with the internet, it is so important that people receive the correct information. And hence the reason we've launched the #ScreenerSaver campaign this year, where people can have access via the internet to the correct information regarding symptoms and treatment options. Facilities, yes, is expensive, but there are NGOs that work together with the corporates to help indigent patients afford mammographic screening. And unfortunately, this is the reason why it is so important for corporate initiatives like our mammographic screening unit to take hands with the public enterprises in order to make it more affordable to patients. And we can say that there are a lot of corporates that do help us sponsor patients to receive mammograms that otherwise could not afford it. And I think it's important for business in South Africa as a corporate social initiative to look at breast cancer screening, because it is one of the best initiatives which they can invest in, not just for their own personnel, but also for the general healthcare of South Africa.
Let's thank you so much for talking to us this morning. Dr. Pieter Henning is the radiologist and director at Keystone Medical, and talking there about breast cancer awareness month. Of course, all of October is breast cancer awareness month.